Someone telling you that it's just in your head is insulting, quite frankly, and it's incorrect. As a comment. So many people struggling with lower back pain for a long period of time have a real mental issue, and it's not their fault, right? They've been told it's in their head, they've been told there's nothing wrong, but they've been told the MRI is normal, they've been told they're going to go for pain management. Pain management's in like 16 weeks, and they're struggling, right? And you don't have confidence. And someone telling you that it's just in your head is insulting, quite frankly, and it's incorrect. And the only way you start to rebuild confidence is through evidence. Evidence that you can actually experience. And that's the job of the rehab. Because when Chris does the correct work and correctly goes through, for example, the tutorials, and sincerely approaches and realizes that he's not very good at the dead bug, can barely do a tabletop, like he said, without losing control. That is so important. It's so much better that Chris does that than kid himself like so many do and force himself to do a normal dead bug incorrectly. And if I continue to make this kind of progress, I know I'm going in the right direction. And that's why I always say, your progress in your symptoms, the resolution of your pain, your numbness, your disability that you have as a result of the back injury, will run behind your progress through the process of rehabilitation. Too many people are saying, I'll wait till I'm feeling better and then I'll be able to do more. It's like, no. You need to develop the ability to do more so you can feel better. So many people have it on its head. And what starts to quell that feeling of anxiety is having the confidence that is built on something that you have done, that you've got videos. You go, gosh, look at me 6 weeks ago. I was bent all over the place with my lower back, and now I'm not. That's what builds, and that really starts to be that's really the only, I would say, or one of the significant antidotes. And that is why going on how you feel is so unwise. And that's why I say it doesn't matter how you feel. It does not matter how you feel. Using how you feel as a cue to go back to the gym, go back to X, go back to Y, go back to Z is preposterous. This will heal significantly faster than your discs, than your herniations, than your lower back. And you have no idea how healed it is. The only thing you can do is have some appreciation for what it's currently capable of dealing with. And that is why your rehab is so important. Forget about how you feel every day, but you do not use that as a judgment for how good you are. Your performance on things like the squat and the hip hinge are essential because they give you that understanding of how healed your back is or isn't. Your exercises are the best way for you to have the evidence, like we were discussing earlier, of how healed you are, because you don't know, because you can't look at the wound, because you can't see. So make sure you're going on how you actually are, not how you feel you are in terms of the healing. And that's why your rehab is so important.